Hey everybody, welcome back to Drug Talk. My name is Garrett Campbell. In today's video, we're going to be doing a more simplified version of a video that we covered in the past on cyclobenzaprine or Flexeril. And we're starting right now. Just keep in mind that this channel is for information purposes only. So the first thing we'll discuss in this presentation is what this medication is used for. So cyclobenzaprine or Flexeril treats pain and stiffness caused by muscle spasms. Now, how to use this medication. So your doctor will tell you how much medicine to use. Do not take more than directed. Take this medicine at the same time each day, and if you're using the extended release capsules, make sure you swallow them whole. Do not crush, chew, split, or break it. If you cannot swallow the capsule whole, you can open the capsule and sprinkle the contents over a tablespoon of applesauce. Swallow the mixture right away without chewing. Rinse your mouth to make sure all of the medicine has been swallowed, and do not save any of the mixture for later. What happens if you miss a dose? Well, take a dose as soon as you remember, but if it is almost time for your next dose, wait until then and take a regular dose. Do not take extra medicine to make up for a missed dose. We'll now discuss some warnings associated with Flexeril. So tell your doctor if you are pregnant or breastfeeding, or if you have liver problems, congestive heart failure, heart rhythm problems, a recent heart attack, overactive thyroid, or a history of glaucoma or trouble urinating. This medication may cause the following problems. So the first one would be serotonin syndrome, but this would be more likely if you were taking other medications that also affect serotonin, as well as dizziness and drowsiness. So do not drive or do anything dangerous until you know how this medication makes you feel. Call your doctor if your symptoms do not improve or if they get worse. Now, for these side effects here on this slide, you would want to call your doctor right away or go see a physician if you experience these. So the first one would be an allergic reaction, so it could be presenting as itching or hives, swelling in your face or hands, swelling or tingling in your mouth or throat, chest tightness or trouble breathing. Now, if you have anxiety, restlessness, fever, sweating, twitching, nausea, vomiting, diarrhea, or seeing or hearing things that aren't there, any combination of these side effects may indicate that you're experiencing serotonin syndrome, so it would also be a good idea to get checked out. If you have a fast, pounding, or uneven heartbeat, or severe drowsiness, fainting, or confusion. Now, these following two side effects, if you experience these in a mild sense, you would just want to talk to your doctor at your next appointment, or even talk to your pharmacist when you're getting your next prescription filled. So that would be dizziness, again, mild dizziness, or dry mouth. All right, everybody, that's all we're going to talk about today with Flexeril or cyclobenzaprine. As always, I'm very thankful you took the time to come by and watch one of my videos. If you find the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.